House Select Subcommittee on the coronavirus pandemic releasing its final report. It details its 2-year investigation of the federal government's failed pandemic response. The 500-page report concludes that the virus most likely originated from a lab in Wuhan, China, and that it could not have been found in nature. The report found social distancing was not based on science and that there was no conclusive evidence that wearing masks protected Americans from COVID. The subcommittee also finding that former New York Governor Andrew Cuomo allegedly committed medical malpractice and publicly undercounted the total number of COVID-related nursing home deaths in the state, and revealed that Cuomo even tried to inappropriately influence testimony from a former aide before speaking to the subcommittee about his administration's COVID policies. Joining me now is the leader of the subcommittee, Ohio Congressman and chairman of the House Select Subcommittee on the Coronavirus Pandemic, Brad Wenstrup. Mr. Chairman, great to see you this morning. Thanks so much for being here.
Yeah, my pleasure. Thank you.
We want to get to all of these details. First, what was the most compelling issue from your standpoint that came out of this report in terms of your findings?
Well, I think what was disturbing, and it kind of sums up everything that followed after that, is the cover-up really by China. Obviously, there was so much attempt to cover everything up to not let us in, destroying evidence, etc. But also there's a cover-up within our government, or at least trying to steer people towards one concept of what maybe happened as opposed to being open and listening, and at other times just being wrong. And then international scientists who also participated in a cover-up by writing articles that claim it must have come from nature, when at the same time they're telling themselves amongst themselves that this thing looks engineered. This isn't something we can tolerate. You know, our investigation was long. It's been a long 2 years. We looked at origins. We looked at the laws and regulations we put in place. We looked at vaccines and treatments, the economy, the effect on the economy, the relief dollars and the fraud. We looked at school closures, education, mental health. We looked at the executive branch, where there was so much obfuscation. And they, when you go to them for documents as a chairman of a House committee, they should say, here's the documents you want. But instead, we're met with lawyers that are holding things back. This is public information. This is information that belongs to the American people. And so, you know, we were authorized and directed to look into these policies, the decisions made, and everything associated with COVID. As I told you a couple of years ago, this is an after-action review, lessons learned, and a path forward. And I think we've done all that to the best of our ability. And, you know, tomorrow we'll release a construct that talks about a path forward, public-private partnerships, recommendations on how we can predict, prepare ourselves, protect ourselves, and maybe even prevent the next pandemic. Yeah, but, you know, I said from the very beginning, even before the committee, America needed to hear from the doctors treating COVID patients. What a different scenario we would have had if doctors walked out of the hospital, lowered their masks, said, here's what we saw today. Here's who's dying. Here's who's most vulnerable, and we should be protecting them. Here's what's working. Here's what's not. It would have made a huge difference, and that's going to be a big part of our recommendations.
I mean, that's just incredible. What a failure on the part of government as well. The Biden administration. Do you believe that the cover-up, when you look at the domestic cover-up, I'm talking about government officials covering up information that American citizens needed and censoring information, working with social media to censor information to basically lie to the public, do you believe that pressure of a cover-up was coming from communist China?
Well, I think people had a lot of reasons. Some people had personal bias. You know, if you are making your living on getting government grants to do risky gain-of-function research, or you've been outly proliferate about gain-of-function research and all the benefits for over a decade, you're going to have a tendency to want to say that this came from nature. That's human nature, to want to be able to do that. But we quelled scientific debate, and people know that. And I think we're going to have a chance in the next administration to actually have the open conversations about what true science really is, and put that forward, and then put a construct in place that will not allow something like this to happen. We need to have unbiased people running the show with no politics, and no personal gain to be part of the conversation. You have to be able to look at everything. That wasn't done. You know, through this process, we even subpoenaed one employee that pled the fifth to all questions that we asked her. This was the person in charge of FOIA for Health and Human Services, and we found out through Dr. Morin's emails that he was going to go to her and find out how he could delete things and hide things, wanted people to go to his Gmail so he couldn't be FOIA'd. Well, guess what? We got all that information, and one of the things he said is this woman, Marge Moore, was the FOIA lady, and she's going to teach me how to do all these things, and she pled the fifth when we brought her in under subpoena.
Unbelievable. Do you believe, I mean, look, there were some people that had the courage to come out and say things that they believed to be true, like Arkansas Senator Tom Cotton, who came on my show in March of 2020. He was on this program in February and March of 2020, who said, no, there's absolutely no way this came from nature. This likely came from the Wuhan lab, and he was attacked for it. And this program was attacked for it, for even mentioning it. So there was so much pressure, even coming from U.S. officials who just didn't want us to know the truth.
Yeah, so what I tried to do is put everything out in a matter of fact and let people make their own decision. Look, before COVID even happened, being on Intelligence Committee, and by the way, everything we're putting out is unclassified. And you know, you heard from John Ratcliffe, who said that everything points to a lab from what he sees.
That's right.
And he gets more information than anybody else.
Correct.
You know, but during COVID,
We are. Go. Do we have you back, Brad Wenstrup? Go ahead. You froze for a second, but please go ahead. Yeah.
Okay. Yeah, during that lockdown, the other doctor sent me an article from 2015 that showed how Ralph Baric in North Carolina and Zheng Liqi in China were able to create new viruses that are potentially more pathogenic. They could do that in the lab. Well, my first thought went to bioweapons, and we have got to embrace that this is a possibility. State Department has talked about China doing 2005, and we've had more evidence since, and this is a real concern. And you talk about preparedness and prevention. We've got to do all we can on an international front as well.
So, Congressman, this is a really important point, and it's a point actually that I have brought up with President Trump as well. After everything that you looked at, Mr. Chairman, do you believe that this was engineered as a bioweapon that China threw at America or the world? Was it a bioweapon?
Well, I do know they have a bioweapons program that looks at coronaviruses. That's been public. They even published a book on it in 2015, which is, interestingly, the same time that Ralph Baric and Zheng Liqi's report came out about creating these types of things. I believe it was accidental, to be honest with you, but I do think that they have a bioweapons program, which this fits into. And of even greater concern is you had U.S. dollars funding the very type of technology and recommending research that could create a COVID-19. So
the follow-up has to be, can they do it again? Can communist China decide to engineer a now you say it was an accident, likely an accident, but could they develop a bioweapon to get Americans sick? I mean, it's not a crazy question given the fact that they're throwing fentanyl into America, killing 100,000 Americans in the last year from poisoning from fentanyl, on top of the COVID scenario just a few years earlier. What's going on with communist China?
Well, communist China is doing can to be aggressive, but we should not be doing things that help fund their military aggressiveness. And look, since the beginning of 2 or 3 centuries ago, we looked at chemical, biological, nuclear, all those types of weaponry, and this is no different. And so technology can be extremely frightening, and out of some things that may be intended to be good, bad things can happen. I don't think the Wright brothers ever intended that people would fly their product into buildings and kill thousands of people. But there are people in this world that try to look at things and see what they can do in a nefarious way, and that includes bioweapons. And Communist China has been researching this for quite some time.
Given your work on the coronavirus subcommittee, as well as your work on the Intelligence Committee, Congressman, I guess what I'm trying to understand is what is Communist China trying to do? I mean, you're seeing surveillance from your work on the Intelligence Committee. The surveillance has really stepped up in the last several years, hasn't it?
Well, yeah, it has. Surveillance in general has, because you always want to be able to find a potential pathogen before it gets out into the community widespread and try and nip it in the bud. So surveillance has gone up on a lot of fronts: intelligence surveillance, and actually like viral surveillance and infectious disease surveillance from all around the world. And that needs to continue. But we cannot write this off. And Maria, there's a lot of things that I think are sitting on the intelligence side that are classified that don't need to be, and need to be released to the American people.
Yeah, I mean, one of the issues is that there's no deterrence from this administration. There were no warnings, there was no deterrence, and there was no accountability for the cover-up that China put in place after COVID, accidentally or not accidentally, was released from that lab.
And when President Biden met with President Xi recently, I saw no indication that he ever even brought up COVID to any extent.
Unbelievable. Congressman, it's great to have you. Thanks so much, and thanks for your work on this.
Thank you, Maria. Appreciate your help.